Our first speaker is past president of this chapter. Most of you know him. I know he has a couple of interesting introductory slides with information about himself and what he likes to do, so I'm not going to tell you all of that. But I would like to introduce Clark Kegley. Clark is the Assistant Vice President of Information Services at Scripps Health. He's been at Scripps for 16 years, and he's been a technology consultant. He's done large-scale implementations, interface development, and you'll learn a little bit about some of his personal interests. So, Clark, welcome, and thanks for being on the program.
I appreciate you guys being here today. It's difficult to take a day out of the office, and I particularly appreciated Steve's comments. I'm from Kentucky. You'll hear a little bit more about that through the slide deck. There's one. Y'all may be kin. Okay? And for us, a hot lunch means the victim was just run over. That's what Grandma used to say. So we're going to talk about a lot of things today. My purpose today, I will not make anyone in this room a better CIO. I will help you understand that CIO stands for careers over. But you knew that already because you joined healthcare. I will not change your work life by telling you things today you don't already know. You're probably in healthcare for the mission, and that's a pretty good reason to get up and go to work in the morning. Hope to make you think and perhaps make you laugh a little bit. Hope everybody had a good Thanksgiving. It was nice to catch up with some old friends and make some new friends this morning as we were walking around. Thanksgiving for me with my wife Leslie and our two sons is always spent in the desert. Well, there's a big poker run race on the Saturday after Thanksgiving. It's about 300 vehicles, so think Mad Max, not the current version, the good version, the original version, for those that are old enough to remember that. So we spend time on Saturday hanging out with friends and racing around in the desert, and I'm getting a little bit older, so I'm not interested in being the fastest, just getting to the finish line. So you might think to yourself, a bald guy with a goatee races around in the desert's probably got a pretty boss dog with a boss name. That's Harley. That is my wife Leslie's dog. Here's mine. Isn't she cute? I call her Jazzy, and just for fun, my neighbors know I'm a bit of a prankster. I'll put a leash on her and walk around the neighborhood, and people I don't know that are visiting will look at me and go, is that guy really walking that little white dog? And I'll just do this. Not everybody gets the joke. The real focus of my life is our 4-year-old granddaughter, Scarlett. Known as the princess, we never tell her no. Grandparents in the room, I'm sure you can appreciate what's great about having grandchildren is you can amp them up and give them back, which is exactly what we do. A little bit about Scripps, 91-year-old organization, 5 acute care hospitals, 29 community-based clinics under 3 different brands, Scripps Clinics, Scripps Coastal Medical Center and Mercy Clinic, Home Health Hospice, 7 medical centers, 4 well-being centers, 3 urgent cares, thank you very much. 40% of the trauma system in San Diego County, 4 emergency departments, several medical office buildings, about $2.5 billion. And there's my cell phone. That would be my wife. Public Speaking 101, they tell you 3 things, right? Turn off your cell phone, get a bottle of water, and visit the men or ladies' room before you show up. I didn't do any of them. My phone is ringing in my jacket right now. About 14,000 employees. We're one of San Diego's largest employers. About 2,600 affiliated physicians and a little north of 1,300 beds. Some of the accolades, we don't really pursue the accolades at all, but you can see U.S. News and World Report. There's some Truvan accolades there, Fortune Magazine, a few things. I think the thing that we're probably most excited about is when we win awards for best places to work for workers over 50. I'm in that category. Best place to work for diversity, best place to work for women executives and women in general. It really speaks to how open, not only our industry, but I think Scripps is in terms of bringing people on board and letting them work. Dr. Eric Topol, one of the 50 most influential physicians and executive leaders, and And my partner coming up after who is far more interesting from Scripps, Dr. Steven Steinhubel, is really a fascinating individual and has a great perspective on technology and how to improve healthcare with technology. Chris Van Gorder, our CEO, has been recognized repeatedly for what he's done for healthcare, one of the most influential people. As I was thinking about putting these slides together, I started to reflect over the Thanksgiving weekend. I'm a Dallas fan, which means I had a lot of time on Thursday to work on my slides, especially after Tony broke the same shoulder again. And I found this slide, and I've used this slide a couple of times, and I think it still works. I'm just going to read it for you. So back in the beginning, let me get this straight. We're trying to pass a health care plan written by a committee whose chairman says he doesn't understand it, passed by a Congress that hasn't read it but exempts themselves from it, to be signed by a president that also hasn't read it and who smokes, and funding administered by a Treasury chief who didn't pay his taxes, all to be overseen by a Surgeon General who is obese and financed by a country that's broke. What could possibly go wrong? And what impact did it have on our industry? Drink up. And that's probably not the kind of fire hose you were thinking of. Everyone is talking about healthcare transformation, innovation, disruption, but the reality is we've done this before. We did it with hardware. For those of you that are into antiquing, that's a deck vax. Makes for an excellent boat mooring, if any of you are boaters today. We've gone from that to this. And this is probably a few years old, and the technology has advanced even more than that. The smartphone in your pocket or on the table in front of you has more computing power than a lot of the mainframes did. And we replaced an IBM System 36 at Scripps. Smartphones, particularly the iPhone, have done some pretty amazing things. This particular example you might recognize. Dr. Eric Topol uses this example of a real-time feed from a patient in Texas used with that patient's permission that was having heart issues, and something that is available to physicians and other clinicians real-time on a smartphone where they can actually make decisions in support of that patient's care. That's pretty brilliant when you think about it. iPad, really don't need any explaining from me. A lot of you have them and use them. A lot of you use them at the bedside. It's a pretty amazing device. We've done it with integration. Healthcare integration 1.0. I came up, as Steve said, through integration. I trained as a programmer, discovered I was a really terrible programmer, had a physician friend that ran the ED at a hospital here in LA. In the maybe early 1980s, he said to me, would you come look at this interface we have in the ED? It's connected up to our Meditech system. I had zero idea what it was about. I went and looked at it, was able to fix it, and discovered I had a niche for connecting disparate healthcare systems. So the analogy here with the wagon wheel for integration in healthcare, in the hub is the interface engine. We're the only industry on the planet that uses interface engines the way we do. Each of the spokes go out to a data source, and we duplicate that data over and over and over and over. Lab system, RAD system, pharmacy system, you name it, those spokes connect. And there's no real way to harness that information for the benefit of patient care, to synthesize it, normalize it, boil it down, and put it into the hands of the individuals that need it when they need it the way they'd like to see it. So let's ask why we continue to do things in our industry relative to integration the same way we are. If you want to talk about disruption, I'm a firm believer that disruption should come from the inside, and if it doesn't, it will come from the outside. So we need to be aware of that. Think about your data analytics program. I was talking with Sherry, who's right. By the way, Sherry, if you sit up front, I pick on you. So I was talking with Sherry about analytics briefly this morning. And analytics in healthcare, we're doing the same thing. We're adding more and more spokes. When Scripps began its journey around data governance for analytics, we did an analysis internally. We had 16 analytics tools, and we were evaluating 3 more. Repeating the exact same mistakes that our industry has repeated over and over. Now, there certainly are organizations that have done this really well, and if you're one of them, I applaud you. We can all learn from you. Healthcare integration 2.0, think of it a different way. In the hourglass analogy, the sand at the very top represents all those sources of data. So the ends of the spokes in the wagon wheel. The bottom part of the hourglass are the consumers of the data. What a physician or a nurse or other clinician would like to see at the bedside is going to be different than what a financial analyst would like to see, or a CEO would like to see, or others who want to see that information, including the patient. Right in the center is a set of tools that helps you accomplish that. There are some very creative things being done by companies like IBM, Informatica, others that are doing very clever things with that skinny part of the hourglass. Really, if you stop trying to think about data as a niche problem that needs a niche solution, and you simply buy one solution, it kind of doesn't matter how many spokes you add to the wagon wheel. You can deal with the data. The basics still apply, not in that order. You notice what's at the top. It's people, process, and technology. We all know that. Don't put technology or innovation at the top of the three-legged stool. Technology for the sake of technology, innovation for the sake of innovation will fail. It's not what you need to do. I don't want to be driving anywhere near this person when they're chatting on the phone. Apple is a brilliant company producing brilliant devices that have made our lives better. But there is a limit to what they can do. Star Wars fans in the room? Makes an excellent lightsaber. What if Apple got in the construction business? My favorite part of this, lower right-hand side, you see the young people sitting on the rock admiring the building? They're so committed to Apple. A lot of stuff going on, a lot of trouble in the world. Sometimes you need to protect yourself. I'm wondering if those lightning connectors will actually hold if Bruce Lee really starts shoving those things around, right? Anybody remember these? These are not a joke, these are real. Put out by Motorola a number of years ago. One of the things that I always do when I produce a slide and speak at an event like this is I sit down with my wife, who knows nothing about technology other than how to work her own stuff, and I run through the slides with her. And I often give her the slide deck and say, would you just look at this and tell me whether it makes any darn sense and whether it's even moderately entertaining. Because I'm a firm believer that I could get up here and talk for 45 minutes about boring stuff that you already know and the challenges that you already have, but I really don't think that's our purpose here today. And when she got to this slide, Leslie said to me, I would never wear that. And I said, you know, I get it. I just don't think anybody would put this on their head. It's not very functional. I agree with you completely. And she looked at me like I'm from Kentucky, because I am. And she said, no, it would mess my hair up. And all I could do was say, mine too. The point is that innovation and technology can get silly if not aligned with the strategic and operational goals of the business. This is not rocket science and it's not groundbreaking. It's what you guys and gals do every single day. A couple of healthcare realities that we're dealing with on a daily basis for all of us. On a good day, healthcare is 15 to 20 years behind every other industry in terms of technology. Not because of the work the people in this room do. It's the legacy nature of the applications that we're all having to deal with in healthcare. It is getting better. Scripps is very early in its epic journey. And we like what they've done with a single database. As an integration guy, that's the right way to do it, but it's pricey to get there. Not every organization can write that check, a little bit north of $500 million over 10 years. That's tough to do and a lot on an organization. Technology will never, ever, ever make a physician or other clinician better. But it could make them faster and it should make them safer. I was talking with a physician friend who said to me, how are you going to make me safer? And it's back to that information topic that we were touching on briefly a second ago. If the right information presented the right way is in that physician or nurse's hand at the time they are delivering care to that patient at the bedside or wherever they deliver it, that is helpful to that clinician. How do you know? You got to ask them. How do they want to see it? And what do they need to see? Healthcare is the most heavily regulated industry on the planet. I think we're slightly ahead of the airline industry in terms of regulation. And our industry is quickly moving from physician-centric to patient-centric. People talk about the whole consumerization of medicine and those kinds of things. I think that consumers are smarter today, and they certainly want that Amazon experience when it comes to their healthcare. How can we support the business to deliver on their strategic goals and objectives? Got to be at the table. For the longest time, the IT shops everywhere, but certainly in healthcare, we were the folks in the basement. At Scripps, our corporate office is a campus called Campus Point. There literally is a basement. And many of us lived in that basement for a long time. I saw Liz McDonald, who's a partner of mine, in the basement. There she is. We lived there for many, many years. We shouldn't be in the basement anymore. We should be at the table having the discussion with the business. You have to understand what clinical or business problem you're trying to solve. If you don't understand that, any piece of technology will fail. That's an important piece. Approach solutions as a business or clinical process analyst. This is very different for a lot of healthcare IT shops. We're technologists, we're engineers. If we build greatness, they will come. No, they won't. What they need are folks that understand business and clinical process and can help them solve a problem. Sometimes technology is not the answer. Don't forget about people and process. Be willing to admit you don't know, but you'd better find out. There's the reference for the Wildcat fan in the room. Just one? I'm the second. Thank you. Thank you very much. I like to use in groups, and Liz has heard this for 20 years at this point. I'm from Kentucky. You have to speak slowly and use small words. Wow, that usually gets a much better response. Thank you. My point is, get the room to relax. When people relax, they'll open up to you and begin to talk about what problems are impacting them. Once you understand those problems, you can bring solutions. It's okay to disagree, just don't be disagreeable. It's okay to be passionate about your perspective on the issue. Just don't get into arguments over it. For the engineers in the room, strikes, works as designed. Or what are your requirements from your vocabulary? Because the reality is, as an engineer, we respect the heck out of all of you. When you say, this works as designed to a customer, what you've just said is, you're an idiot and I'm not. Because I did what you told me to do and you don't like what I did. When in reality, more than likely as the engineer, I didn't fully understand the problem and I didn't craft the right solution. Very important. I say this a lot in meetings. I spend a lot of time playing referee in meetings where I go into meetings where people cannot get past whatever baggage they have to move to the solution. So I will oftentimes start meetings with, everything's my fault. Let's move on. Let's figure out what we need to do. I threw in there, I see some heads nodding. I feel your pain. Or it's IT's fault. No matter what you do, you're blamed anyway. So use it to your advantage, acknowledge it, and move on. The business will eventually begin to mature past it. Sorry, Steve. This isn't about you. Don't let shiny thing syndrome get you in trouble. I've listed here Dr. Prominent. It could be executive prominent. It can be anybody prominent. I really like Steve, and I want to get a Christmas card from him this year. They're at a conference, they see a system or a product, and they absolutely cannot live without. You've got to have a good intake process. You've got to have a way to really define what the problem is. Does that system or technology solve the problem, and does it solve the problem completely? And we'll talk a little bit more about that in just a bit. Problem definition is king. If you cannot write it down on a napkin or a whiteboard, then you don't understand the process fully. You don't understand the problem fully, and you need to deal with that. We all know what happens when you automate a bad process. You get an automated bad process that allows you to make mistakes faster. Nobody in this room wants to be able to make mistakes faster. Speaks to problem definition. Too often organizations fail to evaluate their processes, make the improvements, train their people on those improvements, and then look to see if technology will improve what they've already done. Sometimes the answer is no, it will not. There's the right way. Technology and innovation are not at the top. The sweet spot is in the middle. The MBAs in the room are probably sick and tired of seeing this. Start with process and people. Consider the following. We are a lean organization at Scripps. We're still just a year and a half, 2 years into that journey. At Scripps, we call it value by design. The statement that we make now when a problem is given to anybody in the organization, not just IT, is, have you done an A3 yet? Have you sat down with the multi-box form and really evaluated the problem? And we have an internal training program that trains how to use the lean principles, how to develop an A3. And then we tie it to folks' compensation. So we just completed our fiscal year on September 30th, and one of the goals for everybody in leadership, from the managers on up, is you must have done an A3 for your own area. Identified a problem and then solve that problem using lean principles. And it's really a brilliant way to approach problems if folks are willing to use it. Too often what happens, it becomes the marketing of the week, the flavor of the week. We're going to be lean. We're going to do what Toyota does. And that's as far as it goes. If you're not willing to invest in that to make your organization truly understand how to use that framework, then it's just going to be window dressing. You're not going to get the benefit from it that you like. Adopt the parts of ITIL and ITSM that work for your organization. We're early in that journey today. We're actually replacing our remedy system, which costs us tens of thousands of dollars a year in maintenance, with ServiceNow, which will be millions of dollars once we replace it over a multi-year, 5-year implementation. It won't take us 5 years to implement, but we extend our costs out over 5 years, capital and operating. So a multi-billion-dollar organization is going to spend millions to try and provide better service. Yeah, we are, because it's the right thing to do. We talked about A3s. One of the things that's very close to my heart, I'll pick on Liz again. You're lucky, Sherry, because I saw Liz sitting in the back there. One of the things that we developed 11 years ago is something called the IS Academy. It was patterned after a program that the CEO developed called Leadership Academy. It puts people through a year-long process, gets them exposed to every aspect of the organization, teaches them where $2.5 billion comes from and where it goes, and trains them and gives them a foundation certificate in ITIL. 11 years, we send 25 people a year in IT. We're about a 500-person shop with all of the EPIC resources on deck, so you can do the math. We've sent quite a few people through that. So once we began our ITIL, ITSM journey, we already had a group of folks that had consumed the Kool-Aid. And it wasn't just IT saying it's flavor of the week initiative. People understood why it was valuable. So as you think about people and process, these are important things to do. And lastly, we didn't get this way as an industry overnight, and you're not going to fix it overnight. It's going to take a while for some of these things around process and people to take root. I mentioned about holding folks accountable. I talked about how all of us in leadership are accountable for A3 and lean principles. That continues into the new fiscal year as well. Here's a quick example I'll share with you. This one's a few years old, but our Mercy San Diego Hospital, part of the trauma system in San Diego County, we had an issue, and our issue was very long wait times in the ED, and it's a little bit east of downtown San Diego in an area called Hillcrest. Friday and Saturday nights were referred to as the Gun and Knife Club by folks that worked in the ED. Very, very busy ED. And you can see in the goal some of the issues they were trying to solve there. The wait times were too long. Patient satisfaction was suffering as a result, and sick people were camped out everywhere we could put them, literally everywhere we could put them. So how do you approach that? Lock people in a room. Took them about a week. They started out by writing the problem down on a whiteboard, and they erased it a couple of times as they got through it. They had a good facilitator who knew how to keep the team on track, that once they agreed on what the actual problem was, they had it fully documented. They said, where are the areas of opportunity that we can improve on this? There's no single 100% solution. There could be 25 4% solutions. The point is you break it into manageable chunks. It's the only thing I remember from my programming training is break it into manageable chunks and go after the chunks. And the results, the wait times were so greatly reduced, dramatically reduced, that Scripps advertised in San Diego County wait times in that ED of 30 minutes or less. And they didn't use a single piece of technology. It was good problem definition. It was people that know the issue because they work on the front lines, not leadership. Leadership was there to support the process. And then what improvements can we actually make? Now don't forget, when you do something like this, there's a sustainability issue. So the problem has to take root and you have to be able to maintain it over time. IT shops should be enablers of the business. We need to understand the problem in order to deal with it. Evaluate, modify, enhance the existing process, train your people, track your progress, and then evaluate whether technology will help or not. Standard stuff, not news to anybody here. You really have to develop that business process engineering or redesign skill set within your organizations. A couple of things to think about when you evaluate the problem and craft a solution. Again, these are really designed to help the room relax so that you can get to the real issue. When people go into a room and they start worrying about, am I going to be blamed for this process? And in some cases, there's a lot of folks in healthcare that have been there. I've been with Scripps a little over 17 years, to Steve's point. Some of the people helping you solve the problem may have created the problem to begin with. And you've got to acknowledge that. How do you help them, as the Chinese like to say, save face, and be part of that process so that you can get through all of the baggage that anybody has, and sometimes they don't know they have baggage, to get to the actual solution. I like to say to folks, as a technology enabler, my job is to take all the emotion out of the discussion. Interesting story, I mentored quite a few people at Scripps, and I had a young man in my office that worked on the help desk, and he was vibrating, truly vibrating. He was so mad. He had just gotten his annual review. And I said, tell me about the issue. And as he's holding his review and his hands are shaking, he said, I do all this extra work, I stay late, I come in early, and I don't know why I got a bad review. I said, let me see the review. And on the review, he was cited for 3 long periods of tardiness, 45 minutes, an hour, hour and 15, over a period of about 2 months. I said, so let me make sure I understand. On August so-and-so, were you 45 minutes late without a call-in? Yes, but I do all this extra stuff and, hang on. On September 1st, were you an hour late with no call-in? Yes, but I'm willing to take on all the extra work. And hang on. And one more example. And one more reaction. I said, so the reality is you cannot get to work on time. Right? Don't connect dots that don't belong together. He's a very committed individual, willing to go the extra mile, but until he understood that it didn't mean anything if he couldn't get to work on time, all of those extra efforts were going to be overshadowed. And it's more common, perhaps in our organization, it's more common than you might think. So then the simple question, what's causing you to be late? He had 2 young kids at home. He had just gone back to school to get his bachelor's degree. He was up studying late at night, and it was really hard to get to work at 6:30. Would it help you if you came in at 8? I love the answer. Can I do that? Yeah, you can, because the business need is met, and there are times we need folks to come in at 8. That individual is a manager now in our organization, setting the absolute world on fire, doing a fantastic job. So that people part, it's those soft skills that you guys use every single day. And sometimes when you sit down with someone and say, what's bothering you today? And they say nothing, that's your cue to really have a deeper conversation with them. Let's be candid about how much technology we use today and commit to not repeating the same mistakes. I've seen a couple of studies where in healthcare, we use between 18 and 29% of the functionality of systems we install. So think about that for a second. Finance, manufacturing, other industries, you put in a system, you use less than 1/3 of it, and you call it successful. Now, if I was giving this demonstration to any of those industries, I think at that point people would either laugh or leave. And they'd be right, but we do it all the time. And we don't bat an eye about it. Can you imagine buying a car, taking off 3 wheels, and then taking it on the road? And yet we do it all the time. All participants should agree. You have to have agreement. Because if someone disagrees, you haven't coaxed them out if they're not verbal about their disagreement and what's bothering them. And then act and check and act and check and act and check and check and check and check. And if you screw it up, and you will, be willing to course correct, Own the mistake. Remember, everything's my fault. Let's move on. And then keep going. There we go. I love this slide. Mobile devices, are they really helping? Or is it just one more thing that a clinician needs to deal with? I think it's a mixed answer. Depends on how you use it. Talk to physicians today. You may hear some of this from Steve when he comes up. They're under huge pressure. They're being forced to do a lot of things that they didn't train to do, a lot of it around data entry. And it's impacting the amount of time they can spend with patients. Most doctors that I know, most nurses that I know, most techs that I know entered healthcare to take care of people. And the industry is changing so much, it's preventing them from doing that in some cases. This room is pretty skilled, I'm sure, around things like LANs, WANs. What about HANS? Human Area Network. To talk about this 5 years ago, people might have done, I think my buddy Pat Sweeney laughed. Thanks, Pat. They would have laughed and said, what is a human area network? Well, they're becoming more of the computing environment than perhaps many of us are comfortable with. Wearables, home devices, those kinds of things. When was the last time anybody in this room called a travel agent to book a flight? Now, if your brother owns a travel agency, we don't want to hear from you. That's special. I didn't see a single hand go up, right? So the technology that people are using today in their everyday lives to enhance their well-being, they want their healthcare the same way. Many of us refer to it as that Amazon experience. So the user or their environment is part of the computing process and facilitates data generation, capture, and analysis. So it's Fitbits, it's Samsung watches, it's Apple watches, it's smartphones. But it doesn't stop there. As you think about technology, will the technology make the process produce better outcomes? First and foremost, it has to be better for the patient, period. Is it safer? Is it faster? Is it more efficient? Is it less expensive? And if those answers are no, stop. Be willing to say, we won't meet our goals. And it amazes me how many times in our industry when people consciously know that some or all of the answers to those questions are no, and we keep going. Because we're committed to doing the wrong thing, really? Maybe we shouldn't do that. Maybe we should stop. Maybe we should be willing to say, this doesn't make sense. Many of you are doing this on a daily basis. For those that aren't, something for you to think about. Is this a core competency for IT? Boy, this is changing in healthcare. Why are we in the cell phone business? Show of hands, I think this will be easier. Who in the room does not own a personal smartphone? There are no hands going up. Who in the room would like to carry 2 smartphones? Right? And by the way, that one that your organization issues you just won't let you do a darn thing with it because of the security measures, right? Why are we in the cell phone business? Why are we worrying about BYOD to the extent that we are? Because it's a hybrid solution. Get out of the cell phone business. Why are you in the data center business? We're in the patient care business. We're currently outsourcing our data centers. We have one data center at our corporate office. We have one in the basement of our Mercy Hospital that I mentioned earlier, and we have a disaster recovery hosted site in Colorado Springs that HP runs for us. Shutting them all down. Go into a colo for primary and secondary. It just makes sense. In healthcare, people say, oh, people will lose their jobs. No, they won't. Train them as business process re-engineering specialists, as analysts. Now, that won't work for that third shift operator who's a little funky when he comes in and dresses a little weird, but you'll find something for that individual to do. Security monitoring, we have really expensive engineers that stare at monitors all day. Probably not the best use of that skill set. Now that you've streamlined your operations with some of these principles, consider the following. be the business and clinical process redesign team your organization needs, even if they don't know it. How many times has your organization gone outside and brought in an external expert to help you with process, to help you redesign process, to help you evaluate your IT organization for efficiencies? Doesn't feel good when it happens. Why not be that solution provider? I found an interesting article in a recent copy of Healthcare IT News around an innovation garage. Really, really clever idea. As you think about innovation, as you think about disruptive technology, why don't you create your own innovation garage? You take those really smart people that are staring at security monitors today, or maybe that kind of funky guy or gal that's third shift operators. Those are smart people that can help bring technology to the business based on solutions. You'll have to invest in some training in them, certainly. Not everyone will translate over, and that's okay. But if you do that, you then become that trusted resource that your business reaches out to say, we have a particular problem, will you help us do it? I don't know how things are in your organization, but when our organization used to do it and would bring someone in to solve a particular problem or to evaluate IT, they would hand the invoice to me. So not only does it not feel good to have someone come in and pull your covers up and look at you, but you're going to pay for it at the same time. How about just provide those solutions yourself and not worry about it as much? You've got to be sure to include the business and clinical leaders and the users in those discussions as you put that together. Staff it with people that are repurposed from other areas in your organization that you've been able to collapse and streamline. Your utility side of the house runs fine, or it should. Flip the switch, the light comes on, turn the tap, and water comes out. Maybe not so much in California. That should have already been right-sized and working pretty well. Now you're focused on the service provider side of your business. Give your organization better options, other options, than going outside to always get those service provider things for you. As you begin to do things like this, you'll have a couple of goals that you'll actually be able to achieve. Two other kinds of IT in organizations today outside of what you're all doing: shadow IT, bad IT. That's when folks within your organization go around you because they're not getting what they need. And who do they call when it breaks? All of you. Rogue IT, good IT. It's disruptive, it's experimental, it will fail, that's okay. It's transformational. Think about that innovation garage concept and what it could mean for you folks. Hogue did some brilliant stuff with this a number of years ago and has branched out into retail centers and others. I was picking a Starbucks up this morning and I saw a Hogue Wellbeing Center. And I thought, oh great, another Sniffy Lube. Okay, so now you've done all these things. Now what? Take a look again and again and again at whether you're meeting the goals of the business. So one area that Scripps is expanding is in retail health. We talked about what Hogue's doing. I think probably most organizations either have or will have fairly shortly some retail health presence. So we presented that problem to our technologists a number of years ago and said, we may not even know if it's an acquisition that we're jumping into this business. How can we best connect that organization or that retail health center to the larger Scripps corporate network and be able to do it on a dime? And one of the frontline folks had a brilliant idea and said, what if we take those carts we're not using and build them out for data and voice networking? So it's network on a cart. Simple, brilliant, came from the front line, roll it in, plug it in, turn on the firewall, you're done. Not bad. He understood the problem, communicated the problem, a team looked at the problem, built it with parts we already had. It looks a little bit like Johnny Five, if you remember that movie, but it works really, really well every time. Scripps has expanded on its retail health presence to include a small retail clinic in the basement of a large office building, partnering with the Irvine Company. It's the next growth area or one of the growth areas that many of you are either involved in today or considering getting involved in. The concept around it is, do your hours today in your clinics best serve your physicians, your employees, your nurses, your techs, or do they best serve the patient? How do you know? You ask. And if the patients say, you know what, I'll come before work, or I'll stay after work if I can get access to care, then that's a golden nugget for you to then go back and make actionable. So that small clinic where you can get base routine medical care, staffed by a physician, a PA, an MP, on a rotating basis, a nurse, and a tech, works for them. It's in the lobby, no appointment necessary, come right in. Virtually no wait time. Nobody's building huge hospitals anymore because our customers are demanding more from us. We talked about it before, the legacy nature of healthcare. Get rid of your legacy stuff. For IT at Scripps, it's that remedy system. We have spent 11 or 12 years investing in that remedy system, and we're no closer today than we were when we started. And at some point, you have to say, I don't think this is going to work, and try something different. And by the way, I was the proponent of buying the remedy system. Liz will tell you, she was there. I go to my boss, I go to my boss's boss and say, I was wrong. And I'll fix it. And generally the answer you get is, okay, go fix it. Leave me alone with this. Just make it work. I mentioned before, customers want that Amazon experience. How about data? Remember the wagon wheel? We produce an awful lot of data. What we don't produce is too much information. Data with context is information. Top part of that hourglass, bottom part of the hourglass, based on who the user of the data, the consumer of the data, the way they want it, when they want it, the way they want to see it. For a doctor or a nurse, it's one way. For an executive, it's another way. For a financial analyst, it's a third way. Doesn't matter. You got to satisfy those needs. You may say to yourself, I can't take it. There's too many ways that they're asking for it. So what? Don't do a niche solution for each. Do one solution that allows you to provide it for everybody. And then those repurposed staff that you freed up because you've streamlined your organizations, they can be the analysts that are talking to your customers and saying, hey, Sherry, how do you want to see your data? And then deliver on that. Always take a look at your analytics program. You may recall we talked about the 16 tools, evaluating 3 more. If you don't have governance, get it. And there are other organizations that will share this with you. Start with someone else's if you can't get there. We spent time with UPMC. They were willing to share their governance model. It's a brilliant model. We didn't have anything. We said, let's try this. It may not be 100% for us, but it's better than 0%. And we'll modify it as we go along. Don't overthink it, and reduce the number of tools. So, now that you've got that information right-sized and in a place where you can use it, how are you going to use it for the business? It's well known that about 19% of Medicare recipients get readmitted within 30 days. Represents about $26 billion with a B of added cost, of which about $17 billion is waste. You don't think your CFO or CEO would like a chunk of that? Everybody's budgets go up the percentage they wanted it to this year? Probably not. First time in 13 years that I've managed the budget at Scripps for IT, I was told, keep it flat. 0% increase. And the appetite of the organization has not diminished one bit. So they're asking you for more and perhaps forcing you to do it with less people and with less money. CMS penalized in one reporting period 2,900 hospitals for readmits. Use your analytics program to find those patients in your organization and make them actionable. You want people to cheer about their IT organization? Begin to do things like that. Because what they're doing today is they're buying several tools and they're inviting consultants to come in, and they're still not getting the outcome that they'd like. Consider partnering with others. Show of hands, how many people in the room have a home alarm system monitored by ADT? A few of you. Our house has 18 sensors in it. ADT's customer base is 7 million homes with north of 100 million sensors. If you've ever seen those sensors, I have, because one of the batteries went bad, and the alarm company called me and said, the sliding glass door in your 3rd bedroom has a low battery. How could you possibly know that? Because they're monitoring those systems. How do you leverage that kind of infrastructure for home monitoring? Perhaps for glucose. There are already devices on the market today that wirelessly transmit blood readings. Capture that, make it useful. That's an innovative idea to be able to extend that care experience into the home, because that's where we have to be. A new CPT-4 code reimburses $40 per month for home monitoring. How do we leverage that? Is it enough? We don't know. But if you jump into it, you're certainly going to be ahead of others. And finally, innovate based on need and benefit to the patient. Reduce the legacy footprint. Outsource your non-value-added functions. There's more of them there than you might think if you really take a look at your organization. Be a passionate business partner. It's okay to be excited. Don't let the suit fool you. I'm often the most giddy person that comes in the room because I love healthcare and I love solving problems. It's okay to be a little goofy. It's okay to demonstrate your passion. You got into healthcare for the patient care aspects and the mission. It's okay to show that. Change no to yes, but. Yes, I know you want that thing, Dr. Prominent. But is that the best thing for us to do right now? Let's identify what the problem is and then solution it, because it may not be technology. Sorry, Steve. Just a reminder about the mission. I always enjoy these events. I learn more from you guys than you'll ever learn from me. I really appreciate the time this morning. I especially appreciate you all coming out and spending the day. I think we've got just a couple of minutes for questions, if there are any.